Hi, this is Brynn Hadler of Allergy Bites, and I'm here today with Lydia Cotter, the founder of Your Health Revolution Wellness Clinic and a functional medicine specialist. Lydia is here today to tell us about two people she effectively treated for allergy. Hi, Lydia.
Hey, how you going?
Good.
So thanks for having me on Allergy Bites, and I'm really looking forward to sharing some success stories that I've had where I've treated two clients with allergies. So as a functional medicine practitioner, I work directly with the client and look to treat the whole body, which means that I look at various aspects to do with treating them on an individual cellular level. I use functional medicine as well as looking at diet, lifestyle, internal and external factors affecting their health to understand fully and comprehensively what's going on. So the first client was a teenage female who came to see me, and she had for the last 12 months been suffering with various bouts of tonsillitis. She'd been on antibiotics 10 times in the last 12 months and been off school significant days. She was very inflamed. She had recurrent sinus infections and upper respiratory tract problems. She hadn't breathed clearly for months, and she was a really unwell teenager and was really just sick of feeling sick. So when she came to me, we looked at various factors that could be impacting her health, and in particular, we were looking at the foods she was eating that were causing the allergic responses, which were triggering more inflammatory aspects in her diet and lifestyle. We did RAS tests, so I sent her to the GP to get a blood test to determine what foods she was actually consuming that were affecting her allergic response. And we did come up with what I did suspect. So there was wheat and dairy intolerances as well as allergic responses, and they showed up in the diet quite frequently. She was having a lot of wheat, a lot of dairy, a lot of sugar, and these are all very highly inflammatory foods, particularly if you have an intolerance to them, which can cause huge allergic responses. We looked at addressing removal of those foods from the diet to help the body and the cells in the body to reduce that inflammation. And we also looked at supplementing her diet with really robust and strong probiotics. The probiotic strain that I particularly like to incorporate is Lactobacillus Rhamnosus.
Right.
And this strain is effective because it's used to dampen the inflammatory response. So it brings down the inflammation as well as soothing the gut lining and building up the gut flora. So these are elements that we look at particularly in clients when they have inflammation in their stomach or gastrointestinal tract causing inflammation. And inflammation is present because of the medications that they've been having. If you remember, I mentioned that this client had been on antibiotics 10 times in the last 12 months. And antibiotics are linked to decreasing the gastrointestinal permeability as well as increasing inflammation and reducing the gut flora. And that's what helps us to absorb nutrients. It also helps us to effectively have a strong immune system. And when these are gone, our body isn't able to cope as well when foreign entities such as foods or pathogens or bacteria come into our environment. We're unable to protect ourselves as well. I effectively use high dose probiotics as well as glutamine, and glutamine is also used to heal the gut lining, as well as zinc. So these were three particular products that I gave to this teenager, and over the course of 6 weeks, we used high doses of those products to heal the gut lining, improve her immune system and reduce inflammation, and then allow her body to better react when she was exposed to wheat and dairy.
Right. And you said the antibiotics increase the permeability of the gut lining, correct?
Yeah, it does.
Okay,
So
right.
there's lots of research that shows that antibiotics changes the flora in your stomach, and when the flora which is the healthy and bacteria in your stomach that helps to absorb nutrients. It helps your body to fight against inflammation. It effectively absorbs the nutrients you're eating in your diet. So when you have antibiotics, it wipes the good and the bad bacteria, and it means that your stomach isn't able to function in a healthy, harmonious way.
And was she then able to eat wheat and milk dairy products after that?
So we introduced it slowly. It did take months of trying some small products, and I wouldn't say that I would recommend her to have it with breakfast, lunch and dinner, but she is able to consume it now without having huge allergic responses. So it's not a case of having it with every meal. It's about not being afraid to have to never have it in your diet or not even have it in the cupboard. I call it her treat food, because we don't want to go back down the path of now you can have it every day, because it is an inflammatory food for her in particular. So it's a case of she doesn't have to be afraid of that food anymore.
Right, really important, really important. And I know you also treated a child.
So the other client that I treated was a male who he was also quite unwell with gastrointestinal reflux. He also had severe back pain, so he'd been on quite a lot of strong pharmaceutical medications and to help with the pain management. And as a result, he was having bloating. He had gastro problems like diarrhea and reflux, and was quite unwell. When he came to see me, the allergic responses were happening from rashes to, like I mentioned, the bloating, the constipation, the diarrhea. Certain foods he just knew he had to avoid. In this particular case, we were looking at the gastrointestinal permeability to do with external factors like the pharmaceutical medications, which long-term use had eroded the integrity of his gastrointestinal tract. And as a result, the microbiome, which is the protective bubble layer inside your stomach, it had eroded and the cell integrity had dissipated. Particles of food that would normally go into the blood wouldn't normally go into the bloodstream when they're broken down in the stomach were entering the bloodstream and causing an allergic response, because the body was identifying these food particles as foreign toxic substances, and anything that he was consuming was really becoming quite sensitive to him. And things like pharmaceutical medicine, alcohol, diet, stress, they all have a factor in playing a role in affecting the cell integrity in the stomach. And in this client's particular case, because of the long-term use of the pharmaceutical medications, he'd had the allergic responses to dairy and wheat and eggs. And there were lots of other foods, but those three seem to be the key culprits. So we looked at addressing his reflux as well as the allergic responses he was having by using herbal medicine, quite gentle herbs, so calendula and chamomile, as well as marshmallow. And this isn't the marshmallow you buy at the shops to have in a hot chocolate. This is a plant that is called marshmallow, and it's the root of the plant that gets used. And it creates a nice soothing and coating lining inside the gastrointestinal tract so that we get rid of any inflammation. It helps with the cells to be able to repair effectively so that you can absorb nutrients better and there's a less of an inflammatory response. I also find using slippery elm and glutamine are really effective in healing the cell as well as reducing inflammation in allergic responses. And in this particular client, I also used high-dose probiotics. So again, the Lactobacillus Rhamnosus, and this is a strain that was used effectively recently in a clinical trial at a Melbourne university for children to address peanut allergies. So I'm a big fan of Lactobacillus Rhamnosus. So I make sure that's always incorporated into a probiotic strain that I'll use for a client.
I was going to ask if you had any knowledge of the nut allergy and peanut allergy and what a naturopath's view of that would be.
Yeah, so there was a particular trial that was done in Melbourne, and it was on 60 children who had severe allergic reactions to peanuts. Now, so high dose use of probiotics over the course of the clinical trial, 80% of those children were able to tolerate peanuts in their diets. Even 5 weeks after the trial had been completed. So they're going to do a long-term study on those children. So they'll look at them again in 3 years' time and see the effects of the allergies to peanuts. But it's a really exciting result for those who suffer from nut allergies. That now I do have to say that they were using very high doses of the probiotic, and it was medically supervised. So, but it is really exciting to see that.
Do you know what the dose was by chance?
I don't, because the research that I looked up, it doesn't have the specific dose other than saying it was a high strain. So it was 5 times the usual dosage, but I don't know the exact amount.
And it was just Lactobacillus Lactobacillus Rhamnosus, which is it's the same thing, just different words. Okay, because I know some of them use mixed strains of bacteria, like the Clostridia study a couple of years ago that had really good results too.
Yeah, there's lots of different strains that get used for lots of different probiotic strains that get used in clinical trials. And I have to say, in my clinic, I use a variety of probiotics, not just Lactobacillus Rhamnosus. I found that using a mixture of strains in the one probiotic capsule that I'll give to a client has more effective results. I just wanted to make mention that Lactobacillus Rhamnosus, which was used for this particular trial, because it had such a success, like 80% success rate is huge, and it's really exciting.
It's really great. Well, thank you so much, Lydia, for speaking with us today.
That's okay, and thanks for having me. Hope to speak to you guys again soon.
Definitely. Take care.
Bye.